पहले प्रेगनेंसी के टाइम पे सारा फोकस मदर पे था, लड्डू खिलाए जा रहे हैं, केसर दूध पिलाया जा रहा है, सब कुछ किया जा रहा है। एंड उसके बाद में जैसे ही बेबी आएगा, बेबी पे सब कुछ शिफ्ट, सब कुछ बेबी की बात कर रहा है। बेबी क्राई क्यों कर रहा है? बेबी सोया क्यों नहीं? बेबी ने फीड क्यों नहीं लिया? बेबी ज्यादा पूप क्यों कर रहा है? बेबी ने पी नहीं किया। लाइक इट्स ऑल अबाउट बेबी एंड नोबडी इज टॉकिंग अबाउट मदर।
Hi everyone, welcome to Sisterhood. I am Sankalpana, your host for this video. What is Sisterhood? So this all started when me and two of my friends, Shrestha and Mukta, got together for dinner. We're all women in our late 20s working in Bangalore. As the dinner progressed, we started discussing about our future, work, marriage, children, and we realized कि हम सबको बहुत सारे questions and concerns हैं around childbirth. For example, what really happens to the body during pregnancy? Should we be prepared for a career break? How do we keep our own identity post the birth of a child? And so on. As we spoke to more women in our network, we realized that a lot of them have similar questions and concerns. Unfortunately, there's very little information about this on the internet. So there's a lot of content about babies, there's some content about moms, but there's very little information for people who are not yet moms. We wanted to change this, and so we want to have discussions with people around some of these topics. Today's topic is postpartum depression. It is something that affects around 30% of women post childbirth, but it ranges from mild, also known as baby blues, to more severe forms of depression. Postpartum depression is critical because it can impact the parents' relationship with the child, with each other, and with families. And this video is not just meant for the moms who suffer from postpartum depression, but also for their husbands, for their families around them who play a critical role in managing postpartum depression. Our guest for today is Dr. Sumitra, who is a pediatrician, the founder of a startup called Baby Nama, and also a mom. I'll let Dr. Sumitra introduce herself.
Hi everyone, I'm Dr. Sumitra. I'm a mother and pediatrician. I'm the founder of Baby Nama. Baby Nama is an instant child healthcare platform where a mother just can text on WhatsApp and she will get reply instantly from a trusted pediatrician. If the query is not resolved via chat, then she can schedule a call with the pediatrician and she will connect it with the pediatrician within 15 minutes. So yeah.
Thanks for joining us, Dr. Sumitra. ये podcast record करने से पहले when we were having our own conversation, you told a little bit about your background and your childbirth experience, that you come from a small place in Rajasthan, where people don't are not really familiar with the concept of postpartum depression, but you also went through it post the birth of your child. Could you share a little bit more about, what you felt at that time? Like, what did postpartum depression feel like?
So Sankalpana, see, even being a pediatrician, I didn't know earlier about postpartum depression. मुझे पता ही नहीं था कि ऐसा कुछ होता है, मतलब ऐसा कुछ entity होता है. I knew about post-pregnancy blues, but I didn't know the term as such postpartum depression. I knew there is a term called postpartum depression. So when my son was born, it was normal delivery, and we came home. At that time, I was thinking, okay, like maybe I have gone through long labor, like it was for 24 hours. So I thought maybe I am feeling tired, and that's why I'm not feeling anything. When we came back home, I started feeling like I'm not connecting with my baby, and I was feeling agitated. I was irritable. I was feeling like crying all the time, and I could not sleep. So these are the symptoms I was having actually. More of symptoms, these are the feelings I was having actually. So after that I discussed with my husband कि मुझे ये feeling हो रही है. I'm not able to connect with my baby. मुझे खुशी ही नहीं हो रही है, मतलब I'm not feeling happy. I'm feeling sad. मुझे लग रहा है कि मैं just responsibility निभा रही हूँ. because I'm a mother, but I'm not a good mother. So these are the kind of feelings I was having, and I was crying कि मैं क्यों नहीं फील कर पा रही हूँ. This is the happiest moment of my life, and मैं नहीं फील कर पा रही हूँ ये सब चीजें ना. So फिर then I researched and I asked my fellow mothers actually. मेरे friends जो हैं उनको कॉल किया मैंने जो मदर बन चुकी है, एंड उन्होंने बोला कि होता है ऐसा, बट इट इज नॉट लाइक कि बहुत सीवियर होता है, बट तुम्हें सीवियर हो रहा है ऐसे करके.
Hmm.
देन आई डिस्कस्ड, आई शेयर्ड माय फीलिंग्स विथ माय फैमिली, एंड फिर मुझे लगा कि आई शुड टेक द प्रोफेशनल हेल्प.
Yeah. You mentioned, the feelings of guilt कि मुझे क्यों feel नहीं हो रहा है connection towards my baby? Why am I not feeling happy? That is such a stigma in a lot of places
आई
because
नो.
having a child is always associated with, like you
प्लेजर.
said, this is the happiest moment of my life. Why doesn't it feel like that? A lot of families can have a negative reaction to it, especially the ones that are not aware of that this is a common phenomenon. What has your experience been like?
Okay, so I'll tell my experience. I was lucky in that sense because Ashish was so cooperative. He
Hmm.
was understanding. He was understanding my situation. He was able to listen hours for hours. Even when I was crying, he was patiently sitting beside me, and okay, it's okay. You can cry. That's fine actually. So I was lucky in that sense that I got family support that time. They were listening to me. They were not complaining. They were not judging. But yes, there are many mothers I encounter with this सिचुएशन एक्चुअली. दे से मैम मैं अपने हस्बैंड को बताती हूँ, वो बोलते हैं ये तो नॉर्मल है,
Hmm.
मतलब क्यों नहीं फील कर रही हो, तुम मदर बनी हो तो दिस इज द हैप्पीएस्ट मोमेंट ऑफ अवर लाइफ. ये तो होता है, हार्मोनल है. क्राई करने का मन करेगा, कोई बात नहीं, क्राई कर लो, बट बेबी से तो, बेबी का तो ध्यान रखो, बेबी से तो कनेक्ट फील होना चाहिए, ये तो नहीं है. मतलब दीज काइंड ऑफ नेगेटिव स्टेटमेंट family pass on the mother actually, and this really
Hmm.
happens. I have encountered with so many mothers and I counsel them, it's okay, let them pass the judgment or let them pass this whatever they are saying, but it's okay to feel like this because this is the phase actually you are going through. But yes, there is a lot of negative stigma around it कि आप mother बने हो तो you should feel happy, but it's
Hmm.
not like that.
So it'll be useful to discuss a little bit about why postpartum depression happens. It's a deeper topic, so some reasons might be more hormonal and or biological and out of the scope for our discussion. But in terms of other reasons, like what's going on in the mother's mind when she's feeling depressed.
Okay, so Sankalpana, actually, you are rightly said that postpartum depression is multifactorial. It may be due to hormonal, biological, social, psychosocial, psychological, and due to motherhood issues, sleep deprivation, breastfeeding issue. There are so many things which can contribute postpartum depression. But the major causes are like hormonal, because what happens that there are certain hormones like estrogen and progesterone, they are peak in the pregnancy and they drop down in 3 days after the delivery. So our body reacts in certain ways because estrogen and progesterones are female hormone, and then they drop down. Our sometimes our body might react unexpectedly to that drop down. This is one reason. Second, biological and family history of depression, like if somebody
Hmm.
suffered depression during pregnancy, or somebody was on medication for the depression or anxiety or mood disorder during pregnancy or before pregnancy. And the most important factor is psychological, you can say, or you can say social factor. Must have heard about the 40 days japa tradition in most of the families, that they don't let out mother for the 40 days they just say that you have to sit in this room only. You cannot come out from that room. You just sleep, feed the baby, and you can just sit in this room. How you feel?
Sorry, what is this tradition? Is it like common
Yeah,
in?
this is very common tradition, Japa tradition, 40 days Japa tradition. I don't know, matlab there might be a different name for this, but this is a tradition that 40 days के लिए आपको एक ही रूम में रखेंगे वो. You cannot contact socially other people. You cannot come out, you cannot go out. And मतलब आप कैसा लगेगा अगर आप 40 डेज के लिए एक ही रूम में बेबी के साथ में बैठे हो दिन रात. एंड ठीक है, अभी थोड़ा ये ऐसे है कि हाँ
Okay.
आप मोबाइल वगैरह यूज ले सकते हो, बट वो भी इतना अलाउड नहीं होता है कि हाँ आप मोबाइल यूज लो, क्योंकि आपकी बॉडी अभी इट्स काइंड ऑफ रीबर्थ ऑफ योर बॉडी, सो यू शुड नॉट यूज मोबाइल ऑल्सो. व्हाट विल यू डू?
Is it like more
Yeah.
common in
No, no,
Rajasthan?
no.
I've
It is
never.
common all over India. All over
Okay, okay.
India. The day before yesterday, I was talking to one mother, which is holistic subscribers of our. So she was saying, मैम मैं हॉल में आ रही हूँ आफ्टर 20 डेज. ये भी मेरे लिए बहुत अचीवमेंट है कि मैं बोल रही हूँ मुझे हॉल में जाके बात करना है. अदरवाइज आई नीड टू सिट इन वन रूम
You know,
ओनली.
some of these traditions, इनका जो root होता है, it's with good intention. कि 40 days if the mother isolates, it'll help her recover faster because the body really has gone through a lot. But over time, people evolve, but the traditions don't, and that's why there's a mismatch. And these traditions, the good intentions that they come with, often don't. It doesn't help with that.
यू राइटली सेड कि जब सेट हुए थे ये ट्रेडिशन, तब किसी ने गुड इंटेंशन के साथ सेट किए थे कि जो छोटा बेबी होती है, यू शुड नॉट अलाउ विजिटर्स फॉर 40 डेज सो दैट द बेबी डजंट, यू कैन से, इन्फेक्शन नहीं हो बेबी को. ठीक है,
Right,
तो
right.
उसके लिए सेट किया था. इट वाज नॉट लाइक कि मदर को ही नहीं जाने दो, या मदर को हॉल में भी नहीं आने दो, मदर को सोशली कांटेक्ट भी नहीं करने दो. वो सब चीजें नहीं होती है. बट अभी वो करते हैं लोग कि नहीं नहीं आप यहीं पे रुको. बट पहले के टाइम पे और अभी के टाइम पे बहुत डिफरेंस है एक्चुअली. अभी मदर्स आर मोर सोशल. पहले जो था कि 50 years बैक वो था कि मतलब मदर्स को बस बेबी को बर्थ देना था, फैमिली संभालनी थी, और इट वाज लाइक दैट. बट अभी की मदर्स जो है, दे आर मोर सोशल. देयर ब्रेन वर्क्स लाइक दैट. यू कैन नॉट कीप देम इनटू वन रूम एंड एक्सपेक्ट कि दे विल नॉट सफर फ्रॉम अ डिप्रेशन.
Yeah, no, that's very interesting point. That one thing a lot of people have said to me in different ways about postpartum depression is right before birth, all the focus is on the mother. कि तुमने ठीक से खाया कि नहीं, सो रहे हो कि नहीं. As soon as the baby is born, all the focus is on the baby, and the
Yes.
mother takes like a step back,
Backseat.
and
Yes.
that huge delta, that difference can also lead to feelings of feeling low or just feeling even some sort of resentment.
ऑफ कोर्स, क्योंकि पहले प्रेगनेंसी के टाइम पे सारा फोकस मदर पे था. लड्डू खिलाए जा रहे हैं, केसर दूध पिलाया जा रहा है, सब कुछ किया जा रहा है. एंड उसके बाद में जैसे ही बेबी आएगा, बेबी पे सब कुछ शिफ्ट, सब कुछ बेबी की बात कर रहा है. बेबी क्राई क्यों कर रहा है, बेबी सोया क्यों नहीं, बेबी ने फीड क्यों नहीं लिया, बेबी ज्यादा पूप क्यों कर रहा है, बेबी ने पी नहीं किया. लाइक it's all about baby and nobody is talking about mother. And if they are talking about mother, they are saying तुमने कुछ खाया होगा इसलिए बेबी क्राई कर रहा है, तुमने कुछ किया होगा इसलिए बेबी क्राई कर रहा है. यू कैन नॉट फीड विद द वेट हेयर, तुमने वेट हेयर के साथ फीड कराया होगा इसलिए बेबी को जुकाम हो गया. सो इट्स ऑल अबाउट बेबी. सो इट्स नेचुरल कि ये मदर को फील होगा कि मतलब मैं थी पहले, ठीक है, और अब सब कुछ बेबी के बारे में. व्हाई पीपल आर नॉट थिंकिंग अबाउट मी कि बेबी, I have gone through long labor. I have given birth. Even cesarean section इतना painful होता है. Post cesarean section, mother cannot get up herself actually. So क्यों नहीं मेरे बारे में बात कर रहे हैं, क्यों नहीं मेरे पेन के बारे में पूछ रहे हैं कि मुझे कहाँ पेन हो रहा है, मुझे स्टिचेस में पेन हो रहा है क्या. मैं एंड सेकंड थिंग इज कि बहुत सारे रिस्ट्रिक्शंस होते हैं संकल्पना. यू कैन नॉट ईट दिस, यू कैन नॉट डू दिस, यू कैन नॉट कीप योर हेड bare, you have to cover, you have to like it's all about restrictions on mother. So anybody, even not a mother, अगर इतने सारे restrictions होंगे तो anybody can feel depressed.
There are a lot of, because that time, that maybe like 6 months to 1 year post childbirth is so hectic. Like you said, you're sleep deprived, your body is recovering. You have to feed the baby and just be very, a lot of your time is just going into that. You might even have taken a step back from work.
Hmm.
You're not
Hmm.
visiting your friends either. Just that
Hmm.
entire atmosphere can make you feel like कि मेरी identity चली गई है.
Yes,
It is now I'm the mother of my baby. I'm not Sankalpana that I
myself.
was
Hmm.
before.
Hmm.
Yeah.
Hmm.
So that is one factor. So like that I've realized over the course of many discussions. Ki, like you said, the psychological or psychosocial aspect is also pretty big. The good
Yes.
thing I think is also it's also pretty controllable. If families, husbands and moms, like they prepare for it, it can be
Hmm.
controlled.
Yes, 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 definitely.
So like in terms of preparing for postpartum depression, since you have a lot of conversations with women who are going through it, what are things that husbands, families, close friends, what can they do to make that phase easier?
So, there are like multiple thoughts here. First of all, from the society, actually, you can say, हम ना प्रिपेयर नहीं करते मदर को. Even today we are in 2023 and we are going to enter in 2024, but mothers are not prepared for birth. There are multiple websites, there are multiple, you can say, birth center, but there is no awareness regarding the birth process.
Mm,
So क्या होता है ना कि ठीक है, प्रेग्नेंट हो गए, गायनेकोलॉजिस्ट के पास जा रहे हैं, विजिट हो रही है गायनेकोलॉजिस्ट की, रूटीन टेस्ट हो रहे हैं, बट nobody is telling mother that how the body will change after birth. इट जस्ट हम एक लाइन में बोल देते हैं, वेलकम टू स्लीपलेस नाइट्स. ओके,
mm,
बट वो इतना ही नहीं होता है. देर इज होल स्पेक्ट्रम टू दैट, कि नॉट जस्ट लाइक कि वेलकम टू स्लीपलेस नाइट, वेलकम टू पेरेंटहुड, ये इतना ही बोलती है हमारी सोसाइटी या फ्रेंड्स एंड फैमिली. बट एक्चुअली मदर को क्या करना चाहिए, कैसे प्रिपेयर करना चाहिए उसको, मेंटली, फिजिकली, कि these are the changes you were going to face, these are the changes you might face, and post delivery, during delivery also. One thing I want to highlight here, that there is a lot of pressure for normal delivery on mothers, एक्चुअली फ्रॉम द एल्डर्स, कि नॉर्मल डिलीवरी होनी चाहिए, नहीं तो बाद में एक तो है कि सेकंड बेबी अगर सिजेरियन हो गया तो सेकंड बेबी में प्रॉब्लम होगी, सेकंड की नॉर्मल डिलीवरी होगी तो जल्दी रिकवर कर जाएंगे, कम स्टिचेस लगेंगे, एंड देयर इज अ स्टिग्मा अराउंड नॉर्मल डिलीवरी एक्चुअली, कि नॉर्मल डिलीवरी होनी चाहिए, तो वो प्रेशर भी होता है मदर के पास. बट कोई ये नहीं बताता कि इट्स ओके टू हैव सी सेक्शन. अगर आपको नहीं पेन के थ्रू जाना है, वो जो लेबर वाला पेन है उसके थ्रू नहीं जाना, तो इट्स ओके टू हैव सी सेक्शन. सो हम प्रेगनेंसी के टाइम से ही उसके ऊपर बहुत सारा प्रेशर डालना शुरू कर देते हैं. अगर वो अवेयरनेस हम मदर्स को दे सकें कि वी कैन एजुकेट देम कि बर्थिंग प्रोसेस है, इट कैन लास्ट फॉर 24 आवर ऑल टू 36 आवर्स, एंड इफ यू डोंट वांट टू go through labor, you can have c-section, you can have epidural, you can take painkillers. Those are kind of, and post delivery you will have you will face these issues like sleep deprivation, breastfeeding issue. Nobody ever counsel them or educate them about breastfeeding. So what
mm,
happens in Baby Nama, we kind of educate mothers about breastfeeding. So you won't believe that around 500 mothers each Monday and 500 mothers each Thursday, they join our breastfeeding workshop, and they feel ये तो हमें पता ही नहीं था. that these
One
are.
question there is why is this happening now? Because breastfeeding has been happening for decades, for
Hmm,
centuries,
hmm,
and women knew how to do it.
hmm,
तो फिर
hmm,
अभी
hmm.
ऐसा क्या हो रहा है कि उन्हें एजुकेट करना पड़ रहा है एक एक्सटर्नल एजेंसी के थ्रू?
हाँ, so same question one mother asked in last
हम्म
webinar on Thursday कि मैम पहले भी तो मदर ब्रेस्ट फीड कराती थी,
हम्म
पहले तो नहीं होता था, लो ब्रेस्ट मिल्क पहले तो नहीं होता था मदर्स को, सब कुछ तो ठीक चल रहा होता था, ठीक है बर्थ होता था, उसके बाद में ब्रेस्ट फीडिंग कराती थी मदर है ना, एंड ब्रेस्ट फीडिंग रेट हाई था पहले, अभी क्यों लो हो गया, सबको ब्रेस्ट मिल्क लो ब्रेस्ट मिल्क क्यों होता है? सो संकल्प ना इसके पीछे बहुत सारे रीजंस एक्चुअली। सो अभी ना इंटरवेंशंस बढ़ गए हैं डिलीवरीज में, लाइक आईवी फ्लूइड लगाना, इंडक्शन ऑफ द लेबर, सिडेंटरी लाइफस्टाइल, हमारी लाइफस्टाइल जो है वो इतनी अच्छी नहीं है अभी हमारी ना, जो पहले होती थी, या फिर आप अगर विलेजेस में जाओगे तो देयर लाइफस्टाइल इज much more better than us in urban area. So they have higher breastfeeding rate
हम्म
than the urban area. ठीक है,
हम्म
सो बहुत सारे फैक्टर्स हैं जो मदर्स को, एंड अभी की जो मदर्स हैं वो न्यूक्लियर फैमिलीज में रहती हैं मोस्टली ना, सो
हम्म
कोई एल्डर नहीं है, या फिर कोई जॉइंट फैमिली में कोई रीसेंट बच्चा नहीं हुआ, या फिर 4-5 साल से बच्चा नहीं हुआ जो उनको गाइड कर सके, जो मदर पहले फीड करा चुकी है उनको गाइड कर सके कि हाँ ऐसे फीड कराना है।
Your first point
हाँ,
was कि help mothers prepare,
यस,
and just tying this back to जो आपने अभी last point बोला कि you don't have a community around you anymore.
हम्म,
It's you and your
हम्म,
husband in a
हम्म,
apartment. Maybe friends से इतनी बात नहीं होती
हम्म,
इस बारे में.
हम्म, हम्म,
Um, I feel like getting that community around you pre childbirth, like during your pregnancy, can also help a lot with your depression, because at least the psychological factors around depression, if you're feeling overworked, if you're feeling
हम्म,
ki, I have to spend all my time taking care of the baby, I don't have any time for me, or if
हम्म,
you're feeling like financially under pressure because of a child,
हम्म,
some of
हम्म।
those can be mitigated if you have people around you to help.
So one story I want to tell you here actually. So एक मदर थी हमारे पास में, who is
Hmm.
like friend का friend, common friend की friend है, उन्होंने she joined baby nama, and after that her family is wonderful, like husband is, I know personally, husband is wonderful, mother-in-law is so supportive, still she has gone through postpartum depression. It's not like if your family is not supporting then you will go into postpartum
Hmm.
depression. Yes, there are higher risk if your family is not supporting. But as I said, ki there are multiple factors. Women can go through postpartum depression. So she has gone through postpartum depression but with the right support. Her husband was taking care of the baby in the night time so that she can sleep. Her mother-in-law was taking care of the diet, whatever the doctor is telling, whatever I was telling to her that she should eat this. And then we asked her to take our counselor's help. Then she took the counselor help 3-4 sessions and she got out from that within 1 month. People around you, if they are supportive, you can get out from this situation very early compared to if you don't have support.
Yeah.
So, day before yesterday, I was watching some video and I don't remember actually the community. So the whole community, what they do, they prepare food for you. They take care of baby for you, like shift by shift. And food basket आती रहती है. Mother बस just mother have to just eat and feed the baby and rest. Like they help in household chores also, like turn wise. So
Hmm.
this is kind of community we need if we are living in nuclear family.
Right, right. So, they say कि it takes a village to raise a
Yes,
child. It also takes a village to help the mother as well.
yes.
Yeah. So, like three or four, just summarizing a little bit, the three or four factors you mentioned is role of family. कि एक तो
Hmm,
ये है कि don't do harm. So don't pass comments on the mother's
hmm,
weight.
hmm,
Don't
hmm,
make her feel guilty about not feeling a connection, but instead
hmm.
proactively help her out and
Yes.
come with the expectation कि even if you're doing all you can, the mom can still go through depression because there's a lot
Yes,
of other factors involved.
yes.
And your aim is to help her as much as you can, and she will come out of it. The other factor you mentioned is staying in touch with the doctor, like the आपने जो अपने patient का example दिया है.
Hmm.
Is that this might sound like an ignorant question, but is that something moms in India do? Like, if you give birth, do people stay in touch with their nurse or gynecologist? And vice versa, do gynecologists, nurses even have the time to stay in touch with their patients?
दे डोंट एक्चुअली इसीलिए मैं बता रही थी ना आपको कि इवन व्हेन आवर सन वाज बोर्न आशीष वाज हैविंग आई एम अ मेडिको आई नो these things are normal but Ashish used to have so many like thousands of queries every day why he is doing this why he is moving like this and all those queries na and he was so anxious like more than me, he was going through postpartum depression और postpartum anxiety कि ये क्या हो रहा है ऐसे करके ना. Even I'll honestly speaking, when I was like my son was not born, तब उससे पहले मदर्स छोटे छोटे क्वेरीज लेके आते थे तो मैं बोलती थी क्यों आ रहे हो आप लोग मतलब दिस इज
Hmm.
नॉर्मल यू शुड नो दिस इवन आई फील गिल्टी अबाउट दैट आई पास दैट कमेंट यू शुड नो दिस ऐसे करके ना बट नाउ आई फील दैट वो नहीं था सपोर्ट मतलब डॉक्टर्स का सपोर्ट नहीं होता है.
So, just talking for the average mother, like you said, going to hospitals, having access to doctors is tough. If a mother, if like parents realize that they are going through postpartum depression, Indian medical system में क्या facilities हैं that they can use um, to get over it? Like, who should they be talking to? Should they be talking to some special counselor? Should they be talking to who should they be talking to?
सो अभी ऐसे कुछ सी अवेयरनेस नहीं है पोस्टपार्टम डिप्रेशन के रिगार्डिंग ना इंडिया में बिल्कुल ही अवेयरनेस
You
अवेयरनेस
mean
नहीं है
among the population?
among the population.
Hmm.
अवेयरनेस ही नहीं है कि दे आर गोइंग थ्रू पोस्टपार्टम डिप्रेशन एज आई सेड अर्लियर ना मतलब जो फैमिली होती है वो बोलती है कि ये तो होता है क्राई करने का मन करता है हार्मोनल है तो वो अवेयरनेस ही नहीं है कि दे आर गोइंग थ्रू सो मच एंड मदर क्या करती हैं कि दे हाइड थिंग्स कि अगर
Mhm.
मैं कुछ बोलूंगी तो ये बोलेंगे कि हाँ ये तो होता है दे विल पास
Mm.
कमेंट्स ऑन मी कि कैसी मदर है दे विल लाइक the negative stigma actually
Hmm.
so they will not tell family that how they are feeling so even post pregnancy blues occur in like 75% of mothers 75
Okay.
to
Okay.
80% and out of them around 10 to 30% suffers from postpartum depression but उनको पता ही नहीं होता है I'll tell you one example of my junior actually who is pediatrician herself and she called me one day and कि मैम मुझे ना ये सब फील हो रहा है एंड मेरे हस्बैंड बोल रहे हैं कि हु इज डॉक्टर एक्चुअली कि मेरे हस्बैंड बोल रहे हैं कि कोई बात नहीं ये तो हार्मोनल होता है मदर्स को ऐसा फील ना
Mhm.
एंड वो बोलती है कि मैम मुझे बहुत सीवियर हो रहा है आई एम लाइक इट्स टू मच ठीक है थोड़ा बहुत हार्मोनल मूड स्विंग्स होता है एंड इवन वी फेस ड्यूरिंग पीरियड्स आल्सो menstruation also बट ये तो कुछ एक्सट्रीम ही है एंड आई एम नॉट एबल टू एक्सप्रेस माय फीलिंग्स एंड इफ आई एक्सप्रेसिंग माय हस्बैंड इज सेइंग दिस इज नॉर्मल मैंने कहा बेटा आप ना पोस्टपार्टम डिप्रेशन से गुजर रहे हो यू शुड टेक अ हेल्प ऑफ काउंसलर ठीक है फिर देन वी कनेक्टेड हर टू आवर काउंसलर एंड देन शी टुक द सेशन एंड शी वाज हैप्पी कि हाँ मुझे कुछ तो रिलीफ मिला एंड नाउ आई एम फीलिंग मोर you can say mentally healthy. If somebody is going through postpartum depression, first they should talk to family members, they should talk to friends, they should talk to husband, partner,
Hmm.
and after that if they are feeling that they should take help of a professional then they should talk to a postpartum depression specialist counselor actually it is not a normal counseling you need to listen to mother you need to actually put you in their shoes and you need to think a plan कि उसको कैसे बाहर लेके आना है postpartum depression it is slightly different from a normal depression okay because she has responsibility of baby it's not like she is alone Here I want to point out one more thing, that there is severe form of postpartum depression that we call postpartum psychosis. That is really severe, in that mother has suicidal tendency, and mother has thoughts of harming the baby, and like many other issues. Actually,
Hmm.
it's like very severe form. In that, we admit the mother for a few, you can say, week or so, and then we treat in the hospital. We cannot let mother in at home actually. So this
Hmm.
is severe form where mother should get hospitalized and treated accordingly.
One point that you mentioned, that there's postpartum specific, like specialist counselors that you can seek help from if required. I'm just wondering how many of those even exist in India. Like ऐसे कितने specialists हैं? Maybe sitting in Bangalore I can get access to one, but if someone is like, where you come from or cities around that, from Dosa, right, in Rajasthan, um, let's say someone does realize they have postpartum depression, they need the help of a counselor, how do they even access it?
नहीं होता वहां पे, एक्सेस ही नहीं होता। दौसा में तो आप भूल ही जाओ एक्सेस होता है
हाँ।
किसी को। इवन
हाँ।
साइकोलॉजिस्ट ही नहीं होता
हाँ,
वहां पे,
मतलब
काउंसलर भी
हाँ।
नहीं होता है। जयपुर में यू माइट फाइंड, बट मतलब वो भी फिर नॉर्मल काउंसलर आपको मिलेगा
ठीक है,
मोस्टली।
नॉर्मल काउंसलर।
हाँ, नॉर्मल काउंसलर। अभी थोड़ा हुआ है अवेयरनेस, एंड देन पीपल आर काउंसलिंग ऑनलाइन। सो ऑनलाइन काउंसलर्स हैं, बट इट इज नॉट लाइक कि वो इजीली आपको मिल जाएंगे, या फिर पीपल जस्ट गो टू नॉर्मल काउंसलर।
Yeah. So I guess, like you said, ki, the first step is always your family and friends. Ki, try to solve as much, be as supportive as possible there, and only if needed, then go to a counselor.
Hmm.
So it becomes very important for the husband, for the family, and for close
Yes,
friends to be supportive of that
yes,
issue.
yes. So one more thing I want to point it out, not only mothers actually, fathers can go through postpartum depression. Around 4% to 7% population, 4% to 7% fathers can go through
Hmm.
postpartum depression. So if somebody is going through postpartum depression, the father is going through postpartum depression, they should not feel they should not feel like that. This is only mother's job, or you can say only female can feel it, or female can go through hormonal changes. It's not like that. As I told you, that multiple factors, the sleep deprivation, the family dynamics, the relationship between husband wife, the intimacy between husband and wife get affected during childbirth. So उसकी वजह से फादर भी पोस्टपार्टम डिप्रेशन में जा सकते हैं। तो उनको भी सेम चीज फॉलो करनी है कि दे शुड शेयर देयर फीलिंग्स विद द पार्टनर, दे शुड शेयर फीलिंग विद द फ्रेंड्स, एंड दे शुड टेक help of a professional if they need to take the help.
Yeah, no, that makes sense because a lot of the issues are very psychosocial,
Hmm.
and those same issues exist for the father.
Yes.
A lot of the same issues exist for the father as the mother. So I think that point keeps getting reinforced कि आपके पास अपनी community होना important
Hmm.
है, and that is
Hmm.
something you should prepare for as you start family planning. कि जब आप
Hmm.
बच्चा प्लान कर रहे हो, also plan for that community, that who will be around
Yes.
to support you, whether it's your
Hmm.
friends, your in-laws, parents, siblings,
Hmm.
who's there to support you. Sumitra, if there are mothers watching this who might be experiencing postpartum depression, or if there are husbands and families watching this, what would you want to say to them as someone who's gone through that experience herself?
Okay, so from my experience, one one of the most important key message I want to give is communication, communication, communication. Talk, talk, talk. So and express, express, express कि आप जितना ज़्यादा express कर सको अपनी feeling, express with your partner, express with your friends, express with your family. Don't think that they are thinking negative, they are passing comments on, even they are passing the comments. You just have to communicate your feelings. Don't hide your feelings, because if you are hiding your feelings, it will get accumulated, and further it will deteriorate your mental health. So communicate with your partner that how you are feeling, how they can help. And for the fathers and who is non-affected partner, you should listen. Listen. You should listen all the feelings the mother is telling you. You should listen patiently. Don't pass judgment. Don't pass comment that this is normal. Everybody is going through this. And मेरी मदर भी तो गई थी, मतलब मदर इन लॉ पास कर रही है कमेंट कि मैंने भी तो बच्चे पैदा किए हैं. तो those are the different time. These are the different time. So I would request, and please don't hesitate to take help from a professional, because what really happens that इवन मदर्स को पता चल जाता है कि दे आर गोइंग थ्रू पोस्टपार्टम डिप्रेशन, दे शुड टेक हेल्प, बट नहीं लेते हैं हेल्प. एक्चुअली में नहीं लेते हैं हेल्प. वन ऑफ आवर पेज इज ऑन पोस्ट प्रेगनेंसी ब्लूज. एक्चुअली we post day to like time to time some post on that, and mothers express their feeling. Actually you should see the comments. Okay, कि मैं भी मेरे को भी यही फील हो रहा है, मुझे भी यही फील हो रहा है. When we ask them to take help, they think कि स्टिग्मा है एक्चुअली इसके अराउंड ना, कि they don't want to take help. They feel that somebody, if I take help of counselor, somebody will judge me कि ये तो मेंटल हेल्थ इश्यूज हो रहे हैं इसको तो ना. सो यू शुड नॉट थिंक लाइक दैट. You should prioritize your health over others thinking actually. कि आपको अपना हेल्थ का ध्यान रखना है. If a mother is healthy both physically and mentally, she can take care of baby and the baby will be healthy. So अगर आप खुद के लिए नहीं सोचो तो बेबी के लिए सोच लो कि मेरे बेबी को हेल्दी रखने के लिए आई नीड टू बी फिट मेंटली एंड फिजिकली. So please don't hesitate to take the help.